Hello, I'm Phil Owen with Communities for Recovery and the Targeted Response Team. Today I have a guest, Mr. Bill Rose, our good friend from Shreveport, Louisiana. He is with the Council on Alcohol and Drug Addiction, Northwest Louisiana, correct?
Right, Council on Alcoholism and Drug Abuse.
Can you tell us a little bit about yourself and then let us know what does CADA do?
Okay. Well, my role with CADA is I'm the executive director, been in this position now since, about 8 years. I think in December it'd be 9 years, but I've been working for this organization a little over 22 years. I am a licensed therapist. I primarily serve in the role as an administrator. I haven't gotten to practice therapy in a long, long time, but I've run a lot of our programs, done a lot of training with counselors and other folks in this business. Kind of miss working on the front line with our clients, but I do understand the need for our role as far as administrative services. CADA is a 501c3 nonprofit organization that's been in existence since 1958. We provide both residential and outpatient substance abuse treatment. We have 4 facilities and about 14 different programs that we operate throughout the Shreveport-Bossier area. We provide services, everything from drug screening to outpatient, IOP. We provide adolescent residential. We have services for pregnant women and women with dependent children. We provide detox, high and low intensity residential treatment services. We do have a Veterans Recovery Center as well, where we provide housing and transportation for vets that are receiving IOP services through the VA.
Okay.
So a number of programs across both Shreveport and Bossier area.
Okay, so let's talk about that veteran program. How do they enter your system? Where's your intervention point with your veteran clients?
Well, their point of entry is going to be through the emergency department at the VA. So they're screened through the ER for mental health and substance abuse issues. And if they're in need of addiction services, then they are actually sent upstairs to the SUDS unit for detoxification. And once they're detoxed, then the VA send them over to us, primarily for housing, transportation, and case management. So we don't actually provide addiction treatment for them. It's pretty much housing, transportation, and case management.
Okay.
But they're in a outpatient environment up at the VA hospital.
Okay. Well, I know you mentioned women with children, or a family program, if you will. Are they coming to you by way of a family drug court, or is this open to any women with children that are struggling with addiction issues?
It's open to any women that suffer from addiction issues. Of course, pregnant women are a priority admission into treatment services in Louisiana. So any pregnant woman or women with dependent children can be referred into the program. It's actually funded by TANF. So we get referrals from the court system, family preservation court, any of the court system programs, as long as the woman's pregnant or have a child, or any other referring agency. Like I said, as long as they're pregnant or they have children between the ages of newborn and 12 years old.
Okay, very good. I know those services are greatly needed, and we're lucky enough to have Austin Recovery here that handles that program for us, and I know that's a very appreciated program and highly needed. Well, you mentioned treatment and IOP, and IOP is intensive outpatient treatment.
Right.
Detox. Do you guys handle detox, or do you have a partner that you work with detox?
No, we actually provide detoxification. We have a program where we're primarily detoxing individuals from alcohol, opiates, and also benzodiazepine.
Okay.
So it's anywhere between 5 and 7 days. So if someone comes in, we have a protocol for alcohol withdrawal. We have a medical director and around the clock nursing care. Anyone that's primarily abusing any of the opioids, we can detox those guys as well, using Suboxone and also those that are abusing any of your sedative hypnotic types of drugs. We
Okay.
can detox those guys as well.
So,
Primarily what we're seeing is alcohol and benzodiazepine. I mean, alcohol and opiates, I'm sorry.
okay. And with regards to opiates, is there a medically assisted treatment or recovery program for people that need to sustain on methadone or Suboxone?
Now, we don't provide any of the maintenance services. We work with our local methadone clinic or
Okay.
other providers in the community for those that are on maintenance
Okay.
for opiates. So, we have actually a contract with the state for a LaSOR grant,
Okay.
where we have a crisis mobile outreach team that focuses on the opioid crisis. So if anyone that has to have services related to any of the opiates, our outreach team includes peer services. We have counseling, and we also provide case management as well as nursing care. And anyone that's identified with opiate needs or MAT needs, we can refer those guys to any service provider that provides MAT. Whether it's through CADA or the things that we don't do, we have a connection with other providers in the community, whether it's needs with Suboxone, methadone, uh, pain management, any of those type of things.
Okay. Great. And so with regards to somebody that would like to get services through CADA, what are the funders available? What type of funding could get me into, if I was in Northwest Louisiana or the state of Louisiana and I wanted to get services through CADA, what are my funding options?
Well, most of the folks that we treat in CADA have Louisiana Medicaid.
Okay.
But we are a provider with most of the major commercial insurance companies. So if there's someone that's seeking treatment with us that have insurance and they have a behavioral health benefit, then 9 times out of 10, we're going to be a provider. Now, a lot of times what we're able to do with individuals that we may not be in network, a lot of times we can get single case agreements. So we don't discourage people from contacting us if we're not a provider. Also, if it's an indigent referral, someone that don't meet qualifications for Medicaid and they don't have health insurance, we are a provider with the state of Louisiana to provide services for those guys.
Okay, so to review, if somebody has lost everything, there's a possibility of state funding if they're completely indigent.
Right.
There's Louisiana Medicaid, and then private insurance, or I assume private pay also.
Right. Private pay as well. So let's say, a lot of times, even with the health insurance population, because of their deductibles or their co-pays, because some of those are pretty high, and we work with those guys with payment plans and those sort of things. So we tell people, if you have addiction needs, don't be discouraged if you have a copay or a deductible that's extremely high. We'll make it as easy for you as possible by working with you with payment plans. Because we understand that addicts lose all of their resources as a result of active addiction. And we want to make sure that these people are getting the help that they need.
Right. And I know from my lived experience that when it came time to ask for help, my expectations were to get help right then and there, because that was what I'd hoped for. And hope was everything for me.
Oh, yeah. Yeah.
If I had not been given hope, I would probably still be out there today. So
well, I agree. I'm in recovery myself. And I was really, really blessed at the time to have a job with health insurance. And, and I was glad that it was available at the time I needed it because, there's just no telling where I would have ended up. I was on a path of total self-destruction. And fortunately, because the availability of services and me having health insurance, it was right there for me.
Right.
And I took advantage of it.
Definitely blessed. Um, before we start talking about the climate of today, which is our COVID-19 landscape that we're all living in at the moment, I did want to ask you one thing about linear services. And so we know that somebody can enter into detox, enter into treatment, take IOP, but what goes beyond those services? What does CADA do beyond those services? Is there an alumni program? Do peer services go beyond that? Do therapy services go beyond that? What does that look like for somebody trying to sustain long-term recovery?
Well, we, in addition to the, us having the, both outpatient and residential services where individuals can step down into, we have a full continuum of care. And beyond that, we don't offer anything like recovery homes, but we have a relationship with all of the recovery homes in the community. Oxford houses, and there's several other private recovery homes that we have a relationship. And we invite these guys into our residential services to make a presentation to clients that are in treatment. A lot of times these guys don't have any safe place or stable place to go beyond CADA. So we make available to them relationships with area halfway houses and three-quarter houses. We also have an alumni program, and we started it a couple of years ago. And these guys do all of their own fundraising, and they invite anyone that has a relationship with CADA. And part of what they do in their fundraising effort is to raise funds to make resources available for those that are in treatment and coming out of treatment. For example, if we have a guy that's completed all of CADA services that need to be in a recovery home, and he don't have the deposit of first month rent, CADA's Alumni Association can provide that type of assistance for those clients.
That's awesome.
They create pro-social activities, from barbecues to Survivors Weekend that they do once a month. We're looking on putting that on a sober prom. So all sorts of things for these guys to not only get the resources they need to stay sober and live in an environment that's conducive to their recovery, but they also get them involved in other pro-social activities to keep these guys out of the bars and off the streets.
Yeah, I can't emphasize enough that point that you're making about sober social interactions and activities, how important it is to keep sobriety and recovery interesting for people, because I know for myself, I never thought it could be so,
And me too, and we take the alumni groups into the treatment services and invite these guys to participate in every aspect of the Alumni Association. It's called CADA Connections.
Awesome. That's great. Well, now we get to talk about the fun part, this COVID-19 thing that everybody is having to adapt their services around.
Mm-hmm. Okay.
Can you tell me what kind of challenges and barriers that you guys have seen with COVID-19 and how it's restricting us to adapt to it?
Well, I mean, just like every other business, I think people, I think individuals' fears about contracting COVID-19, or I think it's real, and we've noticed there's a decrease in our admissions. Both at the outpatient clinic. It's a little more steady in the residential program, but it's probably 20 beds below what we normally have. And, I've talked to individuals, family members that were making referrals, or individuals that need treatment, and their big concern is being exposed to other people in situations like hospitals or confined areas. And of course, we take every precaution and follow the CDC's guidelines as it relates to hand washing. We take temperatures. We've modified our screening process where we include questions related to symptoms related to coronavirus and make referrals for those folks that are symptomatic or answer those questions about having those symptoms. I guess the benefit of some of the lower census numbers is if we haven't had any situations where we've had anyone at the clinic or residential that's been positive or symptomatic of COVID-19. But with the lower numbers, it gives us an opportunity to space people out a little bit more.
Right.
You know, where you may have two to a room in our residential programs, we can put single individuals. If someone becomes symptomatic, we have the room to isolate those individuals for a period of time. You know, so it creates a problem, but, you know, it gives us an opportunity to be able to address those challenges in the event someone has a problem within CADA programs.
Right. I think you bring up a good point too, is this is a time in our lives where we need to upspin everything too and look at the bright side and take advantage of what we have. If I put my ear to the ground, I suspect that there's a lot of use and recurrence that we're not hearing about just yet. And it's frightening to me because I know it was impossible for me to social distance when I was in my addiction.
Right.
So my fear is that this is going on at exponential speed, and but it's one of those things that's outside of my control. So it's kind of just keeping our fingers on the pulse. But I like the way you're looking at it, that you're able to space people out and take advantage of the good side of it, because I think that's kind of where our minds need to be right now.
And we're also preparing for, you know, well, we're addressing any fears. And, you know, of course, we don't know. There's just a lot of unknowns. And we try to, you know, addicts and people that have substance use disorders have some legitimate concerns, fears, shame about, you know, stuff that's happened to them as a result of using, but also trying to project what's gonna happen down the line. But in addition to that, we understand, and the information I'm getting from SAMHSA and NIDA, you know, that there's a definite increase, especially in the use of alcohol. We've noticed, I think I've been reading like a 14% increase in the use of alcohol. And, you know, addicts, when we get, we experience anxiety, we tend to use more or go back to an old way, method of dealing with anxiety and stress. So we're trying to prepare ourselves for what happens, you know, post COVID-19.
Right. Tell me this, do you guys have alcohol delivery in Louisiana right now?
What do you mean?
Well, Texas allowed liquor delivery, alcohol delivery during this. So that upped, I suspect, is upping the numbers of recurrence and relapse, as well as people just being able to binge drink. I know that boredom is a huge trigger for me.
Well, not to my knowledge. I haven't heard of any alcohol delivery. I mean, you know, of course, delivery for everything else is up, you know, grocery items, food, but I haven't heard of Louisiana making any changes to state law to be able to deliver alcohol.
Yeah, they've opened it up here, and I'd be quite honest, I thought Louisiana probably started it first, but that's just the way I think.
Well, I'm keeping my fingers crossed, but, you know, I wouldn't be surprised. I hope not.
Right. I hear you on that. I think it's just one other thing to worry about. I certainly respect the right for people to be able to consume alcohol, and certainly within a safe manner. But it does raise some personal concerns for myself, for others.
Right.
So I'm going to go ahead and put the CADA website up on the screen so we can let you know how to view the website, the URL, and the contact number and all that. What I'd like to ask you is, when we come out of COVID-19, what is your vision, or can you look at the crystal ball and tell me what you think service delivery might look like? Is it going to be the same? Is it going to be different? Is it going to be a hybrid of services? What do you think that might be like?
Well, I do suspect because of the isolation, which can create an increase in, or it's creating an increase in the use of both alcohol and illicit substances. I think that when we come out of COVID-19, treatment centers need to prepare themselves for the increase in referrals into services, both outpatient and residential. So I think we need to prepare ourselves for that. I think one of the other benefits that may have happened for a lot of groups, including us, that had moved into telemedicine or making arrangements, and we're actually doing telemedicine for some of our outpatient services as well. So I think that's going to make available for those, we know people that in the rural areas don't have access to transportation to get into treatment. We know that some people are just don't do well in group settings and may do a lot better with individual counseling. So I think you'll see some of those things that will continue to stay, not just because of COVID-19. I think we're going to take a look. We've been looking at, and trauma's been the buzzword for the past couple of years, and I think people are having some traumatic events as a result of COVID-19. So I see that as being a really important thing that we're going to have to continue to address in treatment services. So things like that.
Great. Well, I just want to say one more time, that contact number for CADA is 318-222-8511. That's 318-222-8511. And Bill Rose, it's always great talking to you. I've got one more question on the way out. If you could create a flavor of ice cream, what would that flavor be?
Well, I kind of have something that I mix up. I like the marble slab. I like those places where you could go in and create your own. And I usually get a scoop of sweet cream ice cream, a scoop of strawberry ice cream. I add pecans, walnuts, and almonds, and chocolate chips. Now, I don't have a name for it.
That's okay.
I don't have a name for it.
That's okay. You come back on and let us know when you do have a name for it. We'll promote it.
I will create a name.
Bill says that's that Who Dat ice cream.
That's all right. That's right.
Hey, Bill Rose, great to see you. Thanks for being on the show. And we will talk here real soon, my friend.
Okay. I appreciate it.